What should you do when an elderly person has flu at home? When an elderly person catches the flu at home, it's important to act quickly and carefully because they are more vulnerable to serious health issues. First, contact a healthcare provider as soon as possible. Early medical evaluation can help determine if antiviral medications are needed. These medicines work best if started within the first 2 days of symptoms but can still provide benefits if given later. Always follow the advice of a healthcare professional for proper treatment. Next, try to keep the sick person separated from others in the household. This helps prevent the virus from spreading. Use standard precautions like wearing gloves and masks when caring for them, and encourage them to cover their mouth and nose when coughing or sneezing. Dispose of tissues properly and wash hands frequently with soap and water, or use alcohol-based hand sanitizer. Regular cleaning of frequently touched surfaces like doorknobs, light switches, and phones is also essential to reduce the virus's presence. Supporting the elderly person at home is key. Make sure they get plenty of rest and stay well hydrated by drinking fluids like water, herbal teas, or broths. Over-the-counter medications such as acetaminophen can help reduce fever and relieving aches, but always check with a healthcare provider before giving any medicines, especially if they have other health conditions or are taking other drugs. Monitoring symptoms closely is vital. Watch for signs that requiring emergency care, such as difficulty breathing, chest pain, confusion, dizziness, or if symptoms worsen despite treatment. If any of these occur, seek medical help immediately. It's also important to keep the person at home and avoid contact with others until at least 24 hours after the fever has gone without the use of fever-reducing medicines and their respiratory symptoms improve. Preventing future illness is also crucial. Ensure that everyone in the household, especially older adults and caregivers, gets an annual flu vaccine. Vaccination helps protect against the most common strains of the virus and reduces the risk of severe illness. Always follow healthcare provider instructions for treatment and care, and avoid unproven or harmful remedies. Remember, managing flu in an elderly person involves early medical contact, strict infection control, supportive care, and vigilant monitoring to help them recover safely and comfortably.